All right, I'm going to go ahead and get started. It's a couple minutes after 7. My name is Emily Pipesh. I am the staff social worker here at the Michigan Parkinson Foundation. I have been with the foundation for about 1.5 years now, so I am, learning a little bit more every day about Parkinson's disease, of course, and trying to learn more about the complicated world of insurance and Medicare and Medicaid. So I hope that some of what I share with you tonight is helpful. I realize it's probably not the most fascinating topic, but hopefully you come away with something from it. So I am going to go ahead and pull up my PowerPoint here, and if you can bear with me 1 second, this is actually the first time that I am running a Zoom program, so bear with me 1 minute here while I try to get the PowerPoint up on screen. Okay, can you all see my PowerPoint?
Yes.
Okay, wonderful. Yes. So, okay, good. All right. So, as the title indicates, the subject, making the most of your insurance benefits. And I'm going to go ahead. Actually, I should have done it beforehand and muted everybody. And then if any questions come up, if you can go ahead, if you'd like to type them in the group chat, and we'll try to answer those at the end, or certainly feel free once I get done speaking, I'll go ahead and unmute everybody and we can have a conversation that way. So I will go ahead and mute everybody right now.
I thought you were muted.
Nope. It's only 7 now.
Okay, let's try this again. Sorry, I'm trying to get it back into the slideshow mode here. All right, how's that? Everybody can still see it? Yes, okay. So making the most of your insurance benefits. I want to just start out by saying that all services that you want covered by your insurance, whether it's Medicare, Medicaid, private insurance, anything, has to be based in what professionals, medical providers would call medical necessity. And what that means is that a healthcare service must have the purpose of evaluating, diagnosing, or treating an illness, injury, disease, or symptoms. It has to be in accordance with the generally accepted standards of medical practice. It has to be what's considered clinically appropriate, and it can't, of course, be primarily for the convenience of the patient, the healthcare provider, or another type of physician. And what's really most important to get out of that is that it can't be more costly than an alternative service or sequence of services, and it has to be at least as likely to produce equivalent therapeutic or diagnostic results as to the diagnosis or treatment of that patient's illness, injury, or disease. So basically what I'm trying to say with that is anything that you want covered by your insurance, you have to have justification for. Otherwise, again, it's not going to be covered regardless of what type of insurance you have. So first, I want to talk for a minute about Medicare and what Medicare is. Probably most of you know most of this already, but I just want to review it again. So Medicare is a federally run program. You can qualify for Medicare when you are 65 or older, or if you have certain disabilities and you're under the age of 65. I know that if you have, for instance, end-stage renal disease, you will qualify for Medicare regardless of your age. And I know that there are other disabilities that will qualify you for Medicare. I think blindness is one of them, but typically you have to be at least 65. You can apply for Medicare 3 months before your 65th birthday. And then once you turn 65, your Medicare will become active the month of your birthday. And you are actually automatically enrolled in Medicare once you apply for your Social Security benefits. So as I'm going to discuss, you will be automatically enrolled in what is called Medicare Part A and Part B, which I will discuss in a little more detail momentarily. But basically, when you work, you pay money through your payroll taxes, through FICA, and then you are eligible through the Social Security Administration once you reach the age of 65 again, if you don't have any other type of disability, and you can be eligible for Medicare that way. So Medicare is a national health insurance program. It began in 1966, as I mentioned, under the Social Security Administration. Now it is administered by the federally run Centers for Medicare and Medicaid Services program. There are currently over 58 million beneficiaries. So clearly a very large insurance program in the United States. To speak a little bit about what the different parts of Medicare are. So there's generally 4 parts, A, B, C, and D. Part A is going to be what gives you your hospital coverage. So that will also include hospice. Part A will pay for short-term stays at a skilled nursing facility if it follows a hospital stay of at least 3 days. That will qualify you. Most retirees will not pay a premium for Medicare Part A, but in 2020, there was a deductible of about $1,400 that needs to be met, and there may be additional charges for long hospital stays. Part B is going to be your standard medical insurance. So that's going to pay for your doctor's visits, your outpatient care. You can get a variety of free preventive services. You can get your flu shot. You can get your yearly checkup. And you can go to any doctor, specialist, or healthcare provider that will accept Medicare, of course, and is taking on new patients. Part C is also known as Medicare Advantage. So what that is, that's an alternative to original Medicare. Private insurance companies pay for Medicare approved and sometimes other services, but those will have different prices and restrictions than original Medicare. So that kind of looks more like an HMO. So you might be required with Part C, Medicare Advantage, to use doctors that are in that specific plan's network, and you may need to get a referral to see a specialist. The nice thing about Medicare Part C is that it's comprehensive. So if you elect to purchase a Medicare Advantage plan, that's going to cover other services for you that Part A and B don't. So that can include like your routine dental visits, your eye exams, and it also will allow you access to a program that is called Silver Sneakers. I don't know if any of you are familiar with that, but I definitely wanted to point it out because it's great for our folks with Parkinson's. We know how important exercise is. And Silver Sneakers will allow you basically free membership to, there's thousands of gyms literally across the country. You can pick which ones you want to use as long as they're within the Silver Sneakers program, and you will have the ability to have a gym membership through Silver Sneakers. They also do, I know, a number of like web trainings, kind of what we're doing now with exercise programs. They do things like yoga in the park. So it's a really great opportunity if you are part of the Medicare Advantage program to look into that and see if that can help you out with getting your exercise in. Medicare Part D is going to be your prescription drug benefit. So that is administered through a private health insurance policy, and the premium that you're going to have to pay for your prescription is going to depend on the plan that you select. Plans can charge deductibles of up to $435 in 2020. So it can be pretty pricey. Again, that's a great piece to having Medicare Advantage, is it will help you with that. And then finally, Medigap is another option for folks. So that's not going to be as comprehensive as a Medicare Advantage plan, but it will be a supplemental policy that will help to fill in the gaps of Part A and Part B. And you can use your Medigap coverage to pay for things like your deductibles and copays. So you really have to kind of, look at what your expenses are and decide for yourself what makes the most sense for you, because what makes sense for one person to have a Medicare Advantage plan, for instance, that might make sense for them if they have a lot of really pricey medical procedures, or if they're frequently hospitalized, that might make sense for them. If you're a fairly healthy person, it might not make sense for you to have. And I just wanted to mention, I get a lot of calls about this. So your durable medical equipment will be covered with your Medicare. They typically will pay 80%. So if you need something like a walker or a wheelchair, Medicare should cover that for you of up to about 80%. But again, they're going to want to pay for the least expensive option. So it's really important, which I'm going to discuss about in a little while here, but it's really important to identify what you need before you go ahead and use your DME coverage for any adaptive equipment. Medicare, unfortunately, will not pay for assisted living. It will not pay for somebody to live in a group home. It will pay for short-term rehab or skilled nursing up to 100 days of care per benefit period. And that's really important to know, because if somebody is at a skilled nursing facility and they start to come up to that maximum 100 days, the nursing facility is going to want to have a discharge plan in place for them by the time they reach that 100th day, because after that, Medicare is not going to pay for that person to live there anymore. So it's really important to stay on top of how long you or your loved one have been residing in that rehab or nursing facility. Medicare might pay for vehicle modifications. They will not, unfortunately, cover home modifications such as ramps or widening doorways to get a wheelchair through. They won't cover that, which is really unfortunate for a lot of the people that we support who we know need those types of modifications, but unfortunately Medicare will not pay. And I'm going to talk in a minute about Medicaid, but I just want to point out before I do that a person can qualify for and receive both Medicare and Medicaid at the same time. I think there's some confusion. Some people think that they have to choose one or the other, and that's not the case. If you can receive both, do it. So to talk a little bit about Medicaid, Medicaid is federally and state run. So federally, again, by the Centers for Medicare and Medicaid Services, CMS, but the federal government also gives money to the state of Michigan to run programs. So it's definitely more of a collaboration than Medicare is, which is federally run. There are 72 million beneficiaries of Medicaid in the United States. It is for low-income people and people with limited resources. So typically, when we say low income, most people can make up to about $2,000 per month and receive Medicaid coverage. You can, in fact, own one home and one car and still receive Medicaid. That's something else that I hear often is people think they need to go through all of their assets. They can't have anything left. That's not true. You can have a home. You can have one car. I think your house can be worth up to about $600,000 and your home, or I'm sorry, your car can be worth anything. So you can literally have like a Ferrari and still qualify for Medicaid. You can also have certain life insurance policies, and you can have funeral and burial funds. So a lot of people will require what's called a Medicaid spend down if they make more than that $2,000 a month. They can potentially still qualify for Medicaid, but they will have to do a spend down, which is basically spend down some of their income every month before their Medicaid insurance will kick in. So just for example, if somebody makes $2,100 a month, which as we know is over the $2,000, they may have to pay out of pocket for some of their own medical expenses before their Medicaid will kick in for the remainder of the month. People with Medicaid can qualify at any age. Lots of people who have developmental disabilities that they were born with can qualify for Medicaid, again, if they meet those income restrictions. There's programs through Medicaid that are designed to assist pregnant women specifically. So again, less restrictive than Medicare with the ages that will qualify. And it's really important to know that Medicaid is always going to be what's called the payer of last resort. And what that means is if you have any other type of insurance besides your Medicaid, whether that's Medicare or if that's some sort of private policy, you are going to be required to use that before your Medicaid will kick in, before Medicaid can be billed. Medicaid will always be the ones to pay last. Medicaid and long-term care. So Medicaid can be a great option for folks who need long-term care. They have a lot more options with support than Medicare does. With Medicaid, you can potentially qualify for skilled nursing forever if you continue to meet the criteria for skilled nursing care. So as I mentioned, with Medicare, after 100 days in a skilled nursing facility, you're going to be out unless you can pay on your own. With Medicaid, as long as you continue to meet that criteria and the nursing home that you're living in has a designated Medicaid bed for you, you can continue to live there. So for instance, in my previous job, I served folks who were primarily on Medicaid, like 98% of the people that I worked with were on Medicaid. There were actually some people who chose to live in a nursing home. They had 3 meals a day, they got their meds when they needed. So they actually lived there for years, literally. And that might not be what you or I would want to do, but that is potentially an option for somebody who receives Medicaid. If you think that you are eligible for Medicaid, it is really best to apply as early as possible. We get calls into our office from folks who are kind of in crisis mode and they didn't think they would need Medicaid. They didn't think that they would have an emergency situation. And once you apply for Medicaid, they can take several months to get back with you to let you know if you're approved. I think technically they have 90 days. So if you think that you might qualify, go ahead and apply. It's a cumbersome, tedious application. They ask for lots of redundant information, but really my suggestion to you, if you can get Medicaid coverage, please do it, or please support your loved one if they need it and you think that they would qualify. Medicaid is also nice because in addition to the skilled nursing coverage, they also have a number of programs that are provided by the state of Michigan that will give people an alternative to living in a nursing home. And I've listed what those programs are. They're called the PACE program, the My Choice Waiver program, and then there's one called My Health Link. And the purpose of those is to keep people living in their homes, living in their communities, and out of the nursing home. And why the state wants to do that is because having somebody live in their home is a lot cheaper than providing them with round-the-clock nursing home care. So those are really great options. If anybody wants, I can get you specific information on these 3 programs. Basically, each program will have different eligibility requirements. For example, with PACE, you can have both Medicare and Medicaid to qualify. I believe the same is true with My Health Link. With My Choice, you have to be strictly Medicaid. PACE is, I think, the most comprehensive out of the 3 programs. So that, my understanding, I haven't worked a whole lot with it, but my understanding is that's geared for folks who not only have medical needs, but maybe they have some social needs, maybe they have some psychological needs. It's a really comprehensive program that will give folks, it will set them up with doctor's appointments. It will help them with transportation. It will help them with that in-home care need, if they need personal care. So it's comprehensive. And my choice is more bringing in, I think, just the in-home care support. So your personal care, you know, the home health type of piece. And again, those are great programs. If you want more information, I'm happy to get that for you. There's a really nice document that's actually on the State of Michigan Department of Health and Human Services website, a really nice document that will break up what each of those programs are, what the differences are, and how to determine if you're eligible. Just to talk for a minute as well about VA benefits. So you can receive veterans benefits and also use it with your Medicare. And the VA benefits are nice because they can be used to cover expenses that Medicare typically won't in Part A and Part B. Again, those would be things like your dental exams, your vision exams, and your needs associated with those. And you can also receive long-term care through your VA benefits and respite care. And I believe the respite is actually rather generous for family members. I think it's like the equivalent of 1 month out of a year. So it's definitely something to look into. If somebody who has been diagnosed with Parkinson's disease was in the military during the Vietnam War, and it's suspected that their Parkinson's is related to an exposure to Agent Orange or other chemical agents during their military service, those veterans do not have to prove a connection between the disease and their service time in order to be eligible to receive those VA benefits, as well as disability compensation. Just a few tips that I've kind of learned along the way that I would like to share with everybody. Make sure that you are applying for your benefits at the appropriate times. Again, as I mentioned, Medicare, you can typically apply for 3 months before you turn 65. Medicaid, if you feel there's going to be a need and you think you will qualify, please don't wait. Please just go ahead and apply. And that way you'll be set to go and you don't have to worry about it. The Area Agency on Aging has a really great program called MMAP, and it's Medicare and Medicaid assistance. I'm not sure exactly, professionals maybe, but basically they're counselors. They go through this MMAP program specifically to learn and become experts on Medicare and Medicaid. So if you need some support, they are a great resource to connect with. Again, that would be your local area agency on aging. I've got contact information up at the end of the slideshow. And even if you want to just Google MMAP, they're counselors, they're called counselors. Depending on what part of the state you're in, if you don't have an area agency on aging, it might be called the Council on Aging or Senior Alliance Helpers, but all of those community organizations should have what are called MMAP counselors to help you with any really specific questions that you have. Another tip would be consider paying out of pocket for your lower cost items and use your insurance for those that are more expensive. And specifically what I'm thinking of, and I actually had somebody call me today at the office with this very same situation. His mom used her Medicare insurance for a standard rollator walker, which I think you can probably get off of Amazon.com or a drugstore without a prescription for probably less than $100. And that wasn't working for mom, who has Parkinson's. And she found out, or actually her son found out, that it would be more beneficial for mom to use a U-step walker, which for those of you who aren't familiar, is a walker that's designed specifically for people with Parkinson's disease. It helps when people have freezing episodes. Those cost a lot more money. Those, I think, range between about $600 and $800 depending on the model you get. Well, because mom had already used her insurance for this $100 rollator walker, Medicare said, we've already paid for a walker for you, so we're not paying for another one. So I know that that can be tough. Mom's son, who was calling me, had no idea what a U-step walker was, didn't know that it existed, but it's really kind of important to do your homework, and before you use your benefits, make sure that it's something that you really need, because Medicare will help you once. If you're asking for a similar, or what they consider a similar piece of equipment again, you're going to have to wait a while. It's really important to be aware of ongoing changes to your insurance programs. An example of this would be, I believe previously there were caps on how many therapy services somebody with Parkinson's disease could qualify for through Medicare. And when I say therapy services, I'm referring to physical therapy, occupational therapy, speech therapy. Those, my understanding is, were all capped. And once somebody did all their sessions, you know, they were done. Now, because Parkinson's is recognized as a progressive disease, because it's unlikely that people are going to recover from it, they're not going to recover from it, but they can maintain their skills. Now you can continue to be eligible for therapy services through Medicare if you are maintaining your skills. So now, instead of recovering, the goal is really to avoid regressing. So that just changed in 2018. So again, it's just important to be aware of those changes as they come up. And then finally, I'd just like to say that it's really important to advocate for yourself and your loved one. You know, quite honestly, people who work for the Medicare and Medicaid programs, they are overwhelmed. There's a ton of turnover at those agencies. Things get lost in the mail, things get lost on people's desks, and it's really important to stay on top of it, because ultimately, you know, if you miss out on your benefits, it's going to affect you more than it's going to affect that caseworker. So, you know, if you need to call every day to your caseworker to try to get an answer, if you need to try to speak to a supervisor at your DHS office, do it, because you are your best advocate. And finally, I would just like to talk a little bit about the support that we at the MPF can offer. So again, if you are having issues with getting your benefits approved, if you're having issues with getting responses from your caseworker, we can offer you pro bono legal assistance through the MPF. We have several attorneys who are on our board who work in elder law. They are happy to help us out. If you want to give me a call directly, I can definitely put you in touch with them. They are a great resource for us. They are responsive, and they are really committed to serving folks with Parkinson's disease. To address some of those issues with getting the more costly medications covered, we have a medication assistance program. So at the MPF, we can provide up to $600 per year in funding for those costlier medications. I realize that some of the medications are so expensive, you know, unfortunately $600 may be sort of a drop in the bucket for some of them, but we would like to help with that if possible. I also have some other resources that I can try to connect you with that may be able to help with assistance. So between all of those, we can definitely try to come up with some plan for you. And if you would like an application for that, please let me know. I'll have my contact information up at the end of the slideshow. We are really promoting what we call our respite and in-home care assistance program. As I mentioned, if you are getting Medicare, Medicare is not going to pay for respite. We recognize what a huge need that is. We are very aware of the issues, the problems that come from caregiver burnout. So we have developed this program. It's a great opportunity. We can work with licensed home care providers throughout the state and provide, right now, it's up to about $1,800 a year per family in funding. So it's a great opportunity for caregivers to step out and get a break if that's something that would be helpful to them. And finally, we also have a mobility equipment program. So for those folks that have maybe already used their benefits for adaptive equipment and then realize, hey, I would like to try, or I would like to get a U-step walker, that's really what we keep the most of at the office for folks. That's something that we can certainly help you out with as well. We get them in through donations, and we are happy to share those with you as they come in. So these are just a few contacts for some of the programs that I discussed. And we've got Medicare, Medicaid, Area Agency on Aging, which again, as I mentioned, is going to be really great if you need those MMAP counselors to help you with your really specific Medicare and Medicaid related questions. And then I also have the contact information for the Veterans Affairs Office. So that is all that I have for you tonight. I hope that some of this was helpful to you. And I'm gonna go ahead and try to stop the slideshow here and unmute everybody for some questions. So bear with me one moment. Okay, so I have everybody on unmute. Mary asked, is there a cap on monthly income for the Medicaid spend down? Yes, Mary, I'm sure that there is. I do not know specifically what it is. My assumption would be that whoever is reviewing the case is going to look at not only income, but what other assets are coming in. Do you own a home? Do you have certain insurance policies? And my guess is that there is some fancy formula that they will use to come up with the boundary, the parameter for whether you can qualify based on having a spun down. I do not know of an exact dollar amount. Does anybody have any other questions? Hi, Adele.
Hi, I have a question.
Yeah, go ahead.
My sister is on Medicaid and she needs a walker, but
Okay.
one that is narrow enough to fit through her bathroom door. Is there some that don't take up as much space that you can?
Yes, definitely. There's definitely, I don't know, certainly what your sister's needs are, but there's absolutely a variety of different walkers that are available, and
I
some,
guess I could go on Amazon and look.
yeah, and she might be able to get it covered through her Medicaid. I would definitely go that route before spending any money. But there are certainly a variety of options that should be able to with that, to assist with that.
Thank you.
You're welcome. Anybody else?
Is there any way to pay for exercise places if you don't have silver sneakers? Our insurance doesn't. We don't have silver sneakers because we're not in that Advantage
Right.
program.
Yeah, that's the only program that I know of that will pay. I mean, of course, you can certainly pay out of pocket. And you're more than welcome to join the Michigan Parkinson Foundation Zoom exercise classes, which meet 5 days a week.
We've been doing that. I mean, my husband has been
Are
doing
they
that.
actually 5 days a week or not?
Yes, they're 5 days a week now. Yep, they sure are. 10 o'clock, Monday through Friday.
Some are
Okay.
twice a day.
It's
I was on it today.
Good, good. I hope you enjoyed it. Yeah, and if you miss any of them, you can always check out our YouTube channel, and we've got the previous recordings on there. So that's a great option too.
What do we look under YouTube to find
So
out?
you'll just want to type in Michigan Parkinson Foundation,
Okay,
and the list of classes should come right up for you.
oh, cool.
Yeah, it's great.
I just hope they get the swimming pools opened up sometime.
Yeah, that's a wonderful exercise.
Oh my God, it's killing me.
Yeah. And we have such short summers that
Yeah,
need to be able to take advantage when we can use a pool. So, okay, well, thank you everybody for joining me tonight. Again, if there's any other questions that you might have, or any questions in general about the foundation, I'm happy to speak with you further, and hope to see you all again soon.
Emily,
Yeah,
before you leave,
sure.
you said you would give us your contact information, name, phone number, and all that sort of stuff.
Yeah,
Before you
I'm
left.
sorry. So I had it up. So my direct phone number at the office is 248-419-7170. And my email address is Emily, E-M-I-L-Y, P as in Paul, at Parkinson's with an S, MI.org.
Thank you.
You're welcome.
Emily,
Yeah,
very, very nice, informative evening. Thank you.
thank you, Judy. I appreciate it.
Really a lot of good information.
Thank you.
And will we be able to pull this up and show it If we ever,
Yes.
or when we get back together again?
We will. Yes, absolutely. That will be on the YouTube channel as well with those exercise programs. It should all be in the same spot.
Okay, great. Thank you.
Okay,
Thanks.
you're welcome.
Thank you,
Okay.
Emily.
Thanks for joining, everybody. Have a great night and stay safe, okay?
Good job, Emily. Good job.
All right. Thank
Good
you.
Bye.
Take care. Bye-bye.
Bye-bye.